So I wanted to talk about the jaw surgeries a little bit, where people might have a big lower jaw, a small upper jaw, or a bite that's not as functional as someone who hits all their teeth together. And I see jaw surgeries getting done. And in my particular practice in 20 years, I've never recommended jaw surgery for anybody. I have not found it to be appropriate for any of my patients. And somehow there's a lot of oral surgery groups in town, and I'm sure in other places, in other cities, that do a lot of them. And I can't understand how this is happening. So when I see some of the cases that they do recommend for jaw surgery, I do know that there's other options. For example, there's some orthodontics that can be very successful and potentially a better way to go. I think we have to really realize that the jaw surgeries a lot of times are a plastic surgery to make someone look nicer. People have survived with bites that aren't perfect all the time. I don't find that to be super important that often. I can certainly understand how in a birth defect or in someone who might have a very large lower jaw or very small upper jaw, that this surgery can be beneficial for them. But when it's borderline, why wouldn't we flesh out all the orthodontic options, as many as possible, prior to surgery? Why wouldn't we wait till that child is of the appropriate age to make that choice for themselves, or at least be able to comment intelligently about it? It seems 14 years old, 15 years old. You're dealing with kids that don't know anything, and they're going to have a gigantic change in their life currently, and they're also going to have, what kind of negative sequela can they look forward to when they're 20, 30, 40 years old? There are bad things that happen with that surgery. Seems completely inappropriate for anybody under 18. The last piece that I'll add to this is when us dentists do dental implants, we're not touching a young man who's less than 22 because their face is still growing for one dental implant. For a girl, it's 18. We're not touching a girl until she's 18 or older to put an implant in. Yet we can have some people want to do a dental surgery where they're going to detach the maxilla, cut the mandible when they're 15, 16 years old and everything's still growing. Doesn't make any sense at all. Not appropriate.